Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Plateau Specialist Hospital discharges 25 health workers infected with COVID-19. Trouble in Kwara State as oxygen for patients at University of Ilorin Teaching Hospital is turned off by striking workers. And according to the United Nations, the tourism industry has lost $320 billion amid the coronavirus pandemic, with more than 120 million jobs at risk. Welcome everyone to the program. While the federal government says it is taking more serious precautions as the global fight against COVID-19 continues, the Nigeria Center for Disease Control, NCDC, last night announced more cases of the coronavirus, putting the total number at 52,548. The 321 new cases were confirmed in 23 states and the Federal Capital Territory. The FCT has remained in the top 5 states with total confirmed cases put at over 5,000. As at today, it has the highest number of cases on admission at 3,534, followed by Lagos. And sadly, the nation's capital has recorded 46 deaths. While the nationwide death toll from COVID-19 is put at 1,004 cases, the country reached the undesirable record of 1,000 fatalities on August the 23rd, which, according to the chairman of the Presidential Task Force on COVID-19, is a vivid reminder of the dangers that we still face. So far, 12,287 persons still with COVID-19 are receiving treatment across the country, and the total recoveries are close to 40,000. Now, it's been a frightening situation at the University of Ilorin Teaching Hospital where a patient died following an industrial action by health workers amidst the coronavirus pandemic. According to a family source, the patient, whose name was not given, had been sick and was on oxygen until the striking workers pulled it off on the claims that one of the doctors was assaulted by someone seeking medical attention, and this caused the death of the patient.
He was referred to UITH Ilorin for treatment. He has been undergoing this treatment for a while. He had difficulties in breathing, so that is the only issue he had. And he was okay, very active online. He's always online, WhatsApp, Twitter, and all of that. The only thing that he couldn't talk frequently on phone, but always active online. So he's using the support of oxygen. And it happened that on Tuesday, we heard that the UITH, they went on strike. And that fateful day, they off their lights. And this guy was living on oxygen. And this oxygen was electric oxygen. And immediately they switched off the light. He couldn't use the oxygen any longer. And that was how his system collapsed. And in the process of taking him to another hospital, he gave up. So his family also sought for assistance of ambulance, but they were denied. That the drivers, they were also on strike. So before they could carry him to another hospital, or the private hospital, they carried him to, they rejected him. Some of them said that they didn't have oxygen. And he was eventually taken to the State General Hospital at Taiwood in Ilorin here. And eventually, he gave up before he was even attended to.
Medical Association at the medical center is unhappy with the situation that caused the death of the patient, but insists that as medical practitioners, patients owe them respect as they perform their duties. Dr. Lanre Olosunde, the chairman of the Association of Resident Doctors, Kwara State, advises patients to be civil in their conduct while seeking medical attention.
We have suspended the strike. The strike was informed from a security situation that happened in the hospital, in which one of our doctors was assaulted while on duty. Since then, the management of the hospital has been able to respond with some security measures, at least to some extent, has guaranteed the safety of members being able to work. We felt that our security was not guaranteed then. That's why we had to go on strike. And thankfully, at least there has been some security improvement so far in this regard. It is our hope and prayer that this kind of situation will not occur again. And we are using this opportunity to enlighten the public that even if when you have a situation where you are disgruntled or you are not satisfied with a service in the hospital, that is not the time to take laws into your hands. There are many channels through which you can air your opinion, air your views, air your complaints. There's a Servicom unit of the hospital which has been saddled with the responsibility to take complaints, and they take these matters up with whoever you feel you have problems with. And it's also very important that the public understand that health workers are the ones that are providing care for them. And it's only important, those that are keeping you alive, that you don't assault them.
Plateau State is doing all it can to control the spread of COVID-19, even though it is one of the states with high infection of medical workers. Now, latest report says that about 25 health workers who were infected have been treated and discharged from the Plateau Specialist Hospital, one of the isolation centers in the state. According to our Plateau State correspondent, Yemi Kosoko, 450 persons have been treated and discharged in the center, which is one of the 3 isolation centers in the state.
We manage the patients, and we also manage the staff. That alone is capital intensive. And also the drugs. Some of the patients come with associated comorbidities. For example, a diabetic patient who is strictly on insulin, he cannot really enter all with his insulin there. And so after managing the main COVID, we also need to source out for insulin. And for just a typical example, for those who are also on morbid obesity or severe hypertension, we also need to source out for their medications. Some of them, they have crisis while managing the COVID, during the COVID management, and it's very difficult. We have some difficulties. In fact, at the point in time, we had to create an emergency management tray for management of such emergencies that could occur even at the COVID center. So we have those kind of challenges. And the staff who are managing the patients also, sometimes they also get infected. So we keep on testing the staff managing the patients from time to time.
Over in Delta State, more survivors continue to narrate their experiences with COVID-19. The state government says that plans are in top gear to bring testing centers nearer to the people. The government believes it will help flatten the curve of the virus in the state. As at today, Delta State has recorded 7 new cases of COVID-19, bringing the total infections in the state to 1,708, while the active cases stand at 143. According to figures from the state's Ministry of Health, 22 patients were discharged within the period. Delta remains 9th among the most impacted states in Nigeria with COVID-19, ranking behind Lagos, the FCT, Oyo, Edo, Plateau, Rivers, Kaduna, and Kano. The state has so far carried out tests on over 8,000 persons and has reached 99% contact tracing success, according to the government.
The reason why we are establishing another test center in Owara is to fast-track the process of testing, so that it's not only in Asaba that we can conduct tests of the samples that are collected from different hospitals. We have increased the number of places where we can collect samples, so that as many persons who need our services will be availed the services, and by the grace of God, we believe that in doing so, we'll be able to flatten the curve much faster. Yes, the number of active, by the end of today, of course, the numbers keep changing. So we are hopeful that by the time all the numbers are in, we'll be able to sort that out.
I had malaria symptoms, I had nasal congestion, I had this very strong headache. And immediately I was taken into isolation. In the course of the isolation, the medical personnel did what they were supposed to do. We were given the needed drugs to facilitate the process or to support us. And then there was routine checks. But internally, the headache was still in there, especially for the first 1 week. I also observed that my sense of taste and smell was far gone. My taste buds were not reacting to anything. At the end of 2 weeks, I went for a second test. And unfortunately, it was still positive. It was still positive. And those signs were also there. And I had to wait and follow the process, the procedure as laid down by the regulators, the health officials. And at the end of 21 days, I did another test, and it came out negative.
Now, the COVID-19 is part of the species of SARS-related coronaviruses that have led to previous epidemics over the last 2 decades, known as SARS-CoV in 2002, 2003 in China, also the MERS-CoV, that's 2012, 2013 in Saudi Arabia. But what we know of COVID-19 is that it is presented mainly by the lower respiratory tract-related symptoms, such as fever, cough, chest tightness, and more. But it also causes upper respiratory tract-related symptoms like nasal congestion, sore throat, smell dysfunction, if you heard from some of the survivors. Joining us right now is Professor Titus Ibekwe. He's an otolaryngologist and ENT specialist, also a public health physician. He joins us from our Abuja studios. Glad to have you on the program.
Thank you very much. It's good to be here.
Professor, let's begin. What would you say are the current ENT manifestations of the coronavirus?
Thank you very much. The coronavirus, as you have described, basically the upper respiratory tract is a point of entrance. And for that reason, the typical manifestations that's related to ENT. Very specific ones here include the loss of smell, which one of the survivors have just described, and loss of taste. These two are very unique because we have found out that minimum 1 out of every 3 cases of COVID-19 across the globe, including Nigeria, will present in this manner. And most of the times, this loss of smell and taste even happen before other typical symptoms of COVID start manifesting. And therefore, it could be an early sign, a red flag, that even individuals can use to personally assess themselves. And of course, medical personnel, it should be one of the early screening tools for them to use when they are trying to clerk their patients and ask questions.
Professor Ibekwe.
Recently, it's been observed that the ear is also involved. So fullness in the ear is one of the symptoms which is newly identified.
I wanted to quickly ask, Professor, if I may, just before you continue, you know, because how do we differentiate the loss of taste or smell of COVID-19 and other diseases? You would agree that this has led to some of the reasons why people have disbelief that COVID-19 exists. Some are calling it malaria. So what's the difference? How do you identify that? Because you've also talked about self-assessment that people can do.
Yeah, typically the loss of smell in COVID-19 is unique because unlike in other causes, other ENT diseases that will manifest in this manner, including common cold, nasal tumor, infections, this particular one will come without rhinorrhea, that is running nose, is not usually part of it. Unlike the rest of other ENT symptoms that would lead to this, that commonly comes with running nose. And most of the time, the nasal congestion is long gone, and still the loss of smell and loss of taste are still very much there. So this actually clearly distinguish the type of loss of smell and taste that you see in COVID-19 compared to other ENT diseases. And it is known that there are about 10 times chances of loss of smell and taste occurring in COVID patients when you compare to other illnesses that could lead to loss of smell and taste. So it is really, really clearly distinguished if we look at nitty-gritties when you compare to other manifestations. And a long time, it still stays, even when the patient has recovered from the typical acute symptoms of COVID-19. Fever could have gone and other related symptoms, but the loss of smell and taste will still persist.
Professor Titus Ibiekwe, thank you so much, ENT specialist and public health physician. Thank you for joining us on the program.
Thank you, Millicent. Thank you for having me.
Have a nice day. We have more on the global response to the pandemic when we return. Please join us again. Agriculture is the mainstay of the economy in Ekiti State, and a lot has been done to improve on the skills of farmers there. The coronavirus pandemic has affected the gains achieved in the sector, particularly in funding agriculture. Our correspondent Babajide Agweyo reports that some agriculturists in Ekiti State say all hands now have to be on deck to redouble the efforts to promote the sector.
Some young farmers in Ekiti State are saying the country has some lessons to learn from the current global pandemic, which they say it's having its effects across all sectors. To some of them, the country did not really prepare for the unforeseen in terms of agricultural development and support programs before this time.
A lot of food produce are scarce now. From the north, they can't transport food to the west here. Why? Because there's scarcity, there's increase in transportation. So it has affected a lot of things, and even the atmosphere, everything. Social distancing, no this, no that, a lot of restrictions and rules. But assuming the government has foreseen all this, and then they have put in place a lot of instruments and a lot of rules and regulations, a lot of investments into agriculture. Probably those investments and those save. Maybe they've invested those things and they've kept them in silos, all these grains, rice, and all that. There are a lot of silos here. This is my first time of coming to places like this, and then I saw a lot of silos everywhere, and I'm like, wow, these are food banks. They should be stocked. They're not just meant to be there. They should be stocked with food. And then all these things, storage is very, very good. Now, I believe with this issue of pandemic, our government will no longer be myopic. They will be able to foresee the future and also prepare for the future, so that in case this happens next time, it will get them prepared, not unprepared.
But other experts in the field believe the country will not be overwhelmed by food shortage at this time, despite the effects of the current global pandemic.
They have to follow all the regulation of making sure they are very clean and not getting infected. And if there's any signs, they should follow all the regulations. And they have been doing that. And by that, we now see a gradual return of farmers into their environment and they begin to do their work as required. So there won't be any food shortage as predicted for COVID-19.
The government of Ekiti State says it is doing much in the area of land clearing and other productive partnerships to ensure food sufficiency. The months ahead will definitely define what shape the sector will take. Babajide Agweyo for COVID-19 update.
From agriculture to education, according to the WHO and UNICEF, the unprecedented and prolonged school closures aimed at keeping students safe from COVID-19 are harming them in other ways, urging governments in Africa to promote the safe reopening of schools while taking measures to limit the spread of the virus. A survey shows that of 39 countries in sub-Saharan Africa, schools are fully open in only 6 countries. They are closed in 14 countries and partially open for exam classes only in 19 others. Around a dozen countries are planning to resume classroom learning in September, which is the start of the academic year in some countries. We have joining us in our Lagos studio, Dr. Oluseun Olofi, a public health physician. Thank you so much for joining us on the program.
Thank you for having me.
So do you think that, would you expect the full reopening of schools in September?
Okay, schools, like we know, are not just places for academic instructions alone. They are also places where children have their social and emotional intelligence developed. And these students have been missing out on all this since the onset of the pandemic. So yes, with dropping numbers and daily infection rates, I think it's safe to say that schools should reopen in September, albeit with precautionary measures being put in place to ensure that things go smoothly. Are we looking at what the schools can do to ensure that these students resume safely? Are the schools willing to put in places things like the
The face masks,
hand washing sites? Are they ready to provide PPEs, the face masks and face shields for their teachers and the students? Are they ready to carry out daily temperature checks? Are they ready to put all these in place? Things like downsizing classes might be needed.
That's a big difficulty, especially with the physical distancing.
Because it might require them to hire more teachers to manage these students. Are they ready to do all these things? Are things we should look at before we say schools can safely reopen?
Well, from what you've noticed, looking at the exams for exiting students, we've had some students who have gotten the virus. The government has still gone ahead with that. Do you think that we can apply all of that? And do you think that parents have also taken care with the non-precautionary measures for the students who have been writing their exams?
Okay, with the students writing their exams, we've seen them do things like keeping safe distances. We've seen them wear face masks, wash their hands, sanitize, and we've not really seen a skyrocketing increase in the COVID cases in the country. So, yes, I think these measures are sufficient if they can be followed through. Breaching these protocols, breaching these safety precaution measures would only lead to a rise in the numbers. But so far, we've been doing well. And I think it's applaudable that these measures are put in place, and we hope that it can be sustained. Yes.
All right, so finally, the home front, what should parents start putting in place as much as the schools are preparing?
Okay, yes, we as parents and families have a role to play in this as well. We should learn to educate our kids on the disease. We should learn to let them know why they should take these precautionary measures. It's easier when they understand why they should do this. So we should let them understand why they should wear the masks, keep a safe distance. We should also provide them with hand sanitizers. We should provide them with the masks. And we as parents should actually do these things. Children learn when they see you do these things. They do what you do. So we as parents should do all these, and it will help and go a long way in keeping these kids safe.
It's a bit tricky, safe distance among children.
Yes.
Anyway, we'll see how that goes. Thank you so much, Dr. Olusegun Olofin, public health physician. Thank you for joining us on the program.
Thank you for having me.
According to the United Nations Secretary General, the global tourism industry has been devastated by the coronavirus pandemic, with $320 billion lost in exports in the first 5 months of the year and more than 120 million jobs at risk. In a policy briefing and video address today, Secretary General Antonio Guterres said international tourist arrivals decreased by more than half because of the global health crisis, which has crippled the world's economies.
Tourism is itself one of the wonders of the world. That is why it has been so painful to see how tourism has been devastated by the COVID-19 pandemic. In the first 5 months of this year, international tourist arrivals decreased by more than half, and some $320 billion in exports from tourism were lost. Overall, some 120 million direct jobs in tourism are at risk. Many are in the informal economy or in micro, small and medium-sized enterprises which employ a high proportion of women and young people. The crisis is a major shock for developed economies, but for developing countries it is an emergency, particularly for many small island developing states and African countries. It is imperative that we rebuild the tourism sector, but it must be in a way that is safe, equitable and climate-friendly.
Or for more on the pandemic, you can take a closer look on our website, channelstv.com. It has the latest updates. All you need to do is log on, access news in health, politics, business, sports, Africa, and around the world at your fingertips. You can see the story about the first volunteer receiving the Italian anti-COVID-19 vaccine. There's several other information there. It's channelstv.com. That's it on the program. Thank you for watching. I'm Millicent Nwaka. Have a great day. Continue to stay safe.